I'm so happy here at Wright Morten today, and we've got the lovely vet, Meg.
Hi.
Meg, do you want to introduce yourself to our lovely listeners?
Yeah, of course. I'm Meg. I am a vet at Wright Morten. I've been here almost 2 years now. I'm mainly based on the road, seeing many cases, many different things, a lot of lammy, which is what we're going to talk about.
Yes, so yeah, today's topic is going to be all about laminitis. So we've got an expert, Meg, here, who's going to give us a little bit more insight and knowledge into laminitis, what is laminitis, first of all, how we deal with it, and yeah, how we better look after our horses and ponies with laminitis. So Meg, here, do you just deal with horses? Do you deal with cats, dogs, or just horses?
Just horses,
Okay.
mainly just horses. We do quite a bit of work for the donkey sanctuary as well. So
brilliant.
There's the occasional donkey thrown in there. But
yeah,
no cats, no dogs,
no
cows,
yeah, no cows, no sheep,
no sheep, no cows,
no alpacas,
no, God no.
Brilliant, fab. So laminitis, for people who obviously who's watching who doesn't know what, maybe not know what laminitis is. What is laminitis?
So laminitis essentially is inflammation of your lamina. Your lamina is the your lamina even is the velcro that holds your pedal bone to your hoof capsule. So when that is damaged, you lose that integrity. The velcro then becomes loose, and your pedal bone can drop and fall, and that's what causes the pain and the symptoms that are associated with it.
Okay, and if a horse gets laminitis, what are the clinical signs, or even just at home? If my pony got laminitis, what would I see to say, oh, my pony might have laminitis?
Yeah, so they can range depending on sort of the severity, and horses have different pain thresholds between individuals as well. The usual sign is the leaning back on the heels, trying to take the weight off the toe. They have a sort of stilted pottery gait. Some people think that it looks like a cat walking on a hot tin roof. And this can become a lot worse if you're walking them on stony ground or hard ground. Some of them do tend to lie down quite a bit more just to take the weight off those feet. And sort of other signs are associated with pain. So increased respiration rate, they can be a little bit dull and quiet. But mainly it's those gait changes, so the changes in the way that the horse is moving, that owners tend to notice first.
Yeah. So when they lean back, do they only get laminitis in their front feet then?
Most commonly they get it in their 2 front feet, but they can get it in all 4. Very uncommon just to get it in the back feet or even just 1 back foot, but it's not impossible. But mainly the 2 front feet, yeah.
Is there a reason, like medically, why the horse gets it in their front, not their back?
No, not that I'm aware of. I mean, I guess the front feet technically do hold a little bit more weight than the back, just the way that horses are built and the conformation is. But not that I'm aware of. There's no sort of rhyme or reason to it.
Yeah. Okay. Brilliant. So if I notice, say, my horse had those clinical signs of leaning back, looking a bit dull, should I just? Is there anything I need to do? Like, do I need to call a vet straight away, or does a vet need to come and I don't know, look at the horse and diagnose it?
So there are a couple of things owners can do as a sort of first aid measure. The first is if your horse is out on grass, on a really lush grass paddock, please bring them in. Please bring them into a stable. And when they're in that stable, a really nice deep bed, preferably shavings, just to kind of pad out the feet a little bit and make them feel a bit more comfortable. Diet-wise, you can start straight away with soaking hay, just so that the condition kind of doesn't get any worse. But we always recommend, as soon as you see the signs, to give us a call, even if it is just for advice on the phone. But we'll always offer a visit to come out and assess them.
So as a vet, if you come out, would you just watch how they walk? Is that how you diagnose them? Do they need blood tests, x-ray? How would you go, this pony's definitely got laminitis?
Yeah, so at a typical sort of lammy visit, the horse is usually in the stable, so we feel for pulses. Owners are pretty obsessed with pulses, to be honest, and to be honest, it is kind of an arbitrary way of diagnosing things. It's not just because I feel a pulse doesn't mean they're definitely laminitic. It's hard to tell when you're there on one day what a horse's normal is. That might just be the way that they feel, but they usually are quite raised and bounding, especially if they're very painful with it.
So is it the heart rate when you say pulse?
So we feel the pulse is just underneath the pastern of the front legs and the back legs as well.
So do you feel like a throbbing movement in the lower leg?
Yeah, so some of them are really, really quite raised, so they're really quite easy to find. A lot more difficult on cobs.
With
super carry, you are kind of rummaging around in there for quite a while, and sometimes you're just like, oh, give up and look for the other signs. But pulses is one that we that we tend to kind of go towards. Also, the kind of full clinical exam as well. So they will have that raised heart rate. It's very, very painful as a condition. They will have that raised rest rate. And then we just like to give them a once over, listen to their guts and things like that, just to make sure we're not, you know, it's not a red herring. It usually isn't now.
Yeah.
Sometimes we will ask owners if they can walk them. So I tend not to. If I get to a call and the horse is stood in the stable on a deep bed and is really swinging back on the heels and is really sort of weight shifting and uncomfortable, I don't need to see it be walked. If it is a little bit more sort of vague, I will ask them, oh, can we just take a couple of steps?
Yeah.
But usually an owner will kind of be forthcoming and say, you know, we've been on the hard ground, it's been stony, they're definitely struggling a lot more. And owners tend to be quite good at sort of recognising those signs.
Yeah.
Another thing that we can do is use hoof testers. So they're essentially big forceps. And then we lift the hoof up and we can put them on the hoof and squeeze down and see if there's any reaction there. And you can imagine if your lamina is damaged and your pedal bone has started to sort of fall, you will feel the pressure of us pressing down on it, and some horses really resent that. Some are a lot more stoic. Donkeys in particular will not show a sign of pain until it's really bad. They are really, really stoic creatures.
Yeah.
I have seen a bit of Laminian donkeys actually last year, but I guess just because we don't see as many donkeys here.
Yeah.
But yeah, they are usually really quite
stoic. I suppose, like you said, because they have such a higher pain threshold than your horses, because they're not like donkeys aren't really ridden, they're kind of field ornament, really.
Yeah.
I suppose probably won't see that much because no one's going to call the vet and be like, my donkey is lammy, because they probably won't show signs as much as like a pony, even just being turned on grass, will limp. Or, like you said, those like, you know, leaning back and stuff. Where donkey wouldn't really show that though, would they? Unless they're really bad.
They tend to show the same signs, but as I say, they're
more hardcore.
Yeah, they are more hardcore, a lot more hardcore, a lot more opinionated about things usually as well when we get involved.
Yeah, no, definitely. So obviously the signs that you said are when they most likely has lammy already. Is there any signs that we could see when they're starting to turn lammy, or is there's no signs to just having signs and they're lammy now? Is there a time?
So there's kind of risk factors for lammy that owners hopefully will start to notice. So laminitis in 90% of cases is caused by an endocrine condition. So that basically means a hormonal cause. And the two main ones are Cushing's and EMS. So with Cushing's, owners can sometimes notice the sort of clinical signs, not necessarily laminitis, but those coat changes. So with Cushing's, they tend to get really curly coats, or they tend to find it a lot more difficult to shed the winter coat, or their hair gets longer. Owners do notice if they drink and wee a lot more. Obviously, if you're mucking your horse out every single day and you're thinking, why is this bed so wet? Oh my gosh, my bucket's empty, what is happening? That's another typical sign that owners tend to pick up. And sort of from there, laminitis can develop. So if you are concerned and those early warning signs are there, then definitely get us out to blood test.
So does horses or ponies get the EMS and Cushing's before laminitis, or can they just get laminitis without having the Cushing's and the EMS?
They can get laminitis without Cushing's and EMS. They can get it through trauma. So if they've been worked really, really hard and really hard ground, sometimes that can cause it. Toxins. So I saw a case of a pony that had eaten a big bag of chicken feed. It was not great. And unfortunately, he ended up getting lammy and having to be referred, and that ended pretty poorly, to be honest. But they're the more sort of rare cases. The most cases of lammy that we see have that underlying endocrine cause. So horses that are undiagnosed beforehand sometimes need to have a flare-up of lammy for owners to realise, oh, okay, maybe we should get them tested. But any sort of at-risk pony for those two conditions, I will say, you know, at a visit, let's just blood test them, even if I'm not there for laminitis. Just kind of, you know, be sort of proactive about things. And lammy is definitely one of those conditions where prevention is a lot better than treatment.
Yeah. So if the pony has laminitis already, will that go away, or is that they're lammy forever?
Yeah, so we can treat the laminitis. So if I go to a visit and there's a pony stood in front of me and it's a 5 out of 5 body condition score, it's got a super cresty neck, we've got those 80s style fatty
Yeah.
short hairs. All the alarm bells will be ringing there for EMS. So we can test the insulin and treat the laminitis at the same time. So Lami treatment really is just keeping the pony comfortable. So pain relief, that deep bed, changing the diet so as not to make that insulin spike even more, remedial farriery as well. Whereas the EMS, if their insulin is through the roof, we have drugs and things that we can treat that with. So we're kind of targeting the condition that is causing the laminitis, as well as targeting the actual laminitis as it's happening.
Okay, so you can eventually get that laminitis to disappear.
Yeah.
And I always hear people say, "Oh, they're prone to laminitis." That kind of saying, is that meaning that, I don't know, does that mean that pony has laminitis and they can get it again quite easily compared to other horses, or is there specific breeds that are more, people say, "Oh, they're prone to laminitis"? Like, what does that actually mean when people say it? Like, people just throw that around. I'm like,
I know.
Prone to laminitis. That's like, does that mean it can just lammy all the time?
Yeah. So again, with EMS and Cushing's, if we're not kind of controlling, or at least not checking to see what those levels in the blood are, then you do have a pony that is prone to laminitis. If we've had one flare up last spring when it's been chucked out onto the grass and that insulin this is for EMS ponies, that insulin is spiked, then if we've not changed our management and that pony is then allowed to become fatter and fatter and fatter, bring them in for the winter, there's nothing to say that next spring they won't become laminitic again. It can be really tricky. I think sometimes it is opening a sort of can of worms for some owners, but we really do encourage them to be proactive. And also in this country, there is an obesity epidemic within the horse population, especially leisure horses. And I think we are also used to seeing horses that are overweight, that when we see something that is, in pretty good condition, we're thinking,
oh my God,
it's so skinny. And it's just changing, owners' sort of thinking about that. And again, encourage them to be proactive and work with us and work with their farriers if needs be, in, at least blood testing, and then sort of putting a plan in place before turnout.
Yeah. So from a vet perspective, I know we all like our horses to look healthy, and probably, like you say, we do prefer them to look a bit rounder than they probably should. So from a vet perspective, would you say it's better to have horse and ponies not skinny but on the leaner side than have them on the rounder side, like 365 days of the year?
Yeah. So in winter, if you've got a Welsh mountain pony that's doing its thing out in the wild, they will have that natural weight drop anyway. Obviously, if you've got that domestic horse that's living on a livery yard, come winter, even that we're bringing them in, owners will then tend to sort of supplement the feed and give them huge hay nets. So that natural weight loss in winter just doesn't happen. And sometimes they do tend to put it on because in winter, when it's raining and the weather's horrible and we get about 2 hours of daylight, owners tend to ride less as well.
Yes, that's true.
which is another tricky thing. And we get it. You know, owners have lives to live. They don't want to, spend hours and hours at the stable. We do understand that life does get in the way. But I would rather a pony come into spring having wintered poorly. That's not to say they're a bag of bones.
Yeah.
But to have had that sort of loss of condition, then coming into spring with that sort of, I guess, not nutrition supplemented, but with having kind of too much hay and too much feed over winter and coming into spring.
Yeah.
Poor me.
Yeah, no, definitely. So actually, funny enough, from my understanding of laminitis, I was always told, I always hear, it's when they go on, rich grass or spring grass and stuff, but then you mentioned about it's a hormonal thing.
Yeah.
So how does the pony eating the grass, how does that, like eating the spring grass or fresh grass or a high quality grass, then links to the hormonal, which then causes laminitis? I was always told it was sugars in the grass that causes it.
It can be. I mean, there is still so much that we don't know. For EMS ponies, so EMS is equine metabolic syndrome. It's quite similar to human diabetes. There is a couple of differences, and it has a couple of sort of factors that we need to consider. So the first one is the ponies that are EMS positive can't regulate their insulin. So they'll eat sort of high carbohydrate meals, whether or not that's because they've gorged themselves on the grass, or we've given them, a big bucket of Speedy Beet or whatever it is that you feed them. And instead of the insulin increasing as it would do in a non-EMS horse, it kind of increases tenfold. So they have really sort of huge responses to that. They're also constantly in a hyperinsulin state, so the resting blood insulin levels, are high anyway. And then the third factor is the cells that take insulin up just don't respond to it. So you've got this pony that responds massively, their insulin skyrockets, the cells can't get rid of it, so they're constantly in this huge insulin state. So when we put them out onto the grass and they gorge themselves, that can then push that insulin up and up and up. The insulin then affects, we think, the blood flow to the lamina in the feet, and then that can cause sort of necrosis or at least damage to that lamina, which then leads to laminitis. But there is so much that we don't know about that area, and it's quite interesting research coming through recently, but we think that is the link kind of between insulin and your lamina.
Okay. No, brilliant. I think even throughout, the podcast today, we always say, ponies, fat ponies.
Yeah.
Is it true that ponies are more prone to laminitis than horses? Because you never really say, because everyone always go, fat ponies are more prone. No one ever says a fat horse.
Not necessarily. Little ponies obviously are treated differently to horses. Being small, you've only got a certain number of people that can exercise them, which is your young kids. Once your child has kind of grown out of their little Section A pony and it's left to become a field ornament, I think that's kind of why we do see not necessarily more ponies prone to lammy, but I think why they are just the management factors. They can't be exercised basically, and they aren't exercised. They do tend to be left as lawn mowers, whereas your horses that are big enough to be ridden do tend to get exercised a lot more. But sort of any animal, so any native breeds, so your Welsh Ds and Cs, your cobs are kind of more prone to obesity, to holding excess fat, as well as your pony. So it doesn't, just because you've got a 15-2 hand cob doesn't mean you can chuck them out in the field and not have to worry more than you would if you had a 13-1 Section A. So if
the horse or pony is a little bit more overweight, does that mean that they just have the hormones are harder for it to work because they're fatter and they can obviously hold everything more and then cause laminitis?
So fat tissue, adipose tissue, actually releases something called cytokines, so little chemical messengers, and then they've been known to affect the lamina as well. So your fat tissue actually doesn't cause laminitis, but is a factor that can make it worse and can make you more prone to it. It can also cause kind of more sort of chronic disease as well, as we see in humans, so you sort of heart diseases and things like that. So fat tissue doesn't necessarily also cause laminitis, but it can release those sort of stress chemicals that can then contribute to that condition developing, as well as your insulin.
So like a horse or pony in our ideal or correct weight, can they get laminitis as well, even though they're not, they have no cresty necks, no fat? Can they get laminitis?
It's not impossible. It's a lot less likely. If you've got an 18-year-old horse and they get laminitis, the first thing I'd be thinking of is Cushing's. Cushing's doesn't really have a sort of relationship with insulin dysregulation as EMS does. Insulin is a tiny sort of part of it, and Cushing's can cause your insulin to raise, but it's a completely sort of different mechanism. We can talk about the difference between the two conditions if you want in a little bit. But what was the question again? My train of thought.
If we had a horse or pony in like a normal weight,
yes,
because we always say, a fat pony gets laminitis. So does that mean they can only get if they're fat? If they're like normal weight, they wouldn't get it?
No, not necessarily. Again, as I said before, it's less likely. But you've got two types of fats. You've got your superficial fat, which is the one that we can see, so that cresty neck, the fat coverage of the ribs, the big sort of peachy apple bum. The peachy bum.
I definitely don't have.
Me neither, girl, because I'm sat on it. The peachy bum, and that sort of thing that we can see. They can also have visceral fat, which is fat surrounding the organs, which, unless we get a huge MRI machine and stick a horse in there, which we can't do, we won't be able to see it.
Yeah.
So just because your horse is sort of lean doesn't mean you shouldn't be concerned about your management and helping to prevent, lambing from happening. It can still happen. It does happen. It's just a lot less likely.
Okay, yeah. So with laminitis, is there a specific age range, I can't even speak now, age range that you see is common? So like, I don't know, normally around 15-year-olds, or can it happen when they're even a 2-year-old? Because I normally see it in my role, like older ponies get it. Is that just because they're getting old and their system is not as good as it used to when they're younger to be able to control these hormones? So do you normally see it in like older ponies or horses, or is it a wide range of age?
A wide range of ages, to be honest with you. It again does depend what is causing it. So EMS we tend to see in horses kind of 5 years old and above, so between sort of 5 and 10 years old. And then Cushing's is definitely a disease or a syndrome of the older pony. So any pony, some people say 12, some people say 15, but any pony that I go and see that's kind of 12 years plus that has lambing and has, maybe a long coat, or is just a little bit quieter, or has lost a little bit of weight, then I'll be thinking Cushing's.
Yeah, brilliant. You said obviously care for them will be able to make them comfortable and things like that. And you said about farrier. What can the farrier do to help and support the pony?
So I really enjoy working with farriers. I think laminitis is one of those conditions where sometimes it does feel like too many cooks spoil the broth. But if you have that relationship with the farrier and with the owner, you can take really big steps in keeping your pony a lot more comfortable. So a lot of farriers, when they're called out to a laminitic, will usually want x-rays.
How come?
They can see where that pedal bone is sitting in the foot, and then see the hoof wall, and then kind of figure out which parts of the foot they can take off safely. If it's a really bad laminitic and we think the pedal bone's dropped quite a bit, then it's just really useful to see for vets and farriers alike. There's a lot of farriers that, if your pony is really painful, really do encourage you to get x-rays so that they can work with them. There are quite a few options. So people have probably heard of heart bars before. So this is just taking the weight off the sole of that foot at the toe where that pedal bone is pressing down, and transferring that weight to the frog instead. And that can kind of improve comfort levels quite significantly. In really chronic, painful cases, you can also get little wooden clogs. They're quite cute, actually, and that can kind of...
They're made of wood?
I think they're either... we had a case in here. This was almost 2
years
ago. Yeah, little clogs. They look like obviously they're not Louboutin heels. They're all quite raised up off the ground. And I've seen those make a huge difference as well. But it just kind of depends on the horse, depends on the case, and it depends on the budget as well, because
it can be expensive.
It can be expensive. I think everything in veterinary and farrier and everything with horses
is expensive.
Yeah, it is expensive.
Is expensive.
Exactly. So we'll always try and work with owners and farriers and sort of recommend the best route to go down. If that's not something that we can do, then we'll always have a plan B involved.
Yeah. What you said, obviously, with the pedal bone, seeing how much it drops. If it does drop a little bit and the farrier and the laminitis improves, can that pedal bone go back to where it is, or is it forever staying at that? Once it's dropped, it can't come back up even. Like like with the farrier, you can probably prevent it from dropping more. But can you actually bring it back up? Is it possible?
Once you've fixed your lamina and the integrity between your two Velcro layers is there, it will stop it from falling any further. It's very rare that you can get it back into kind of the right place that it should be, which is why your farrier is so important, because if we've got them out of that flare up of lambing and they're comfortable, then kind of maintaining hoof health, so keeping sort of the weight bearing angles at a sort of, as sort of, what's the word I'm looking for?
Level,
yeah. Keeping those weight bearing angles at a level that the horse is comfortable with is really important as well. So laminitis, it does affect that integrity, and you'll sometimes will see those divergent rings as the hoof tends to grow out. I don't know if you've ever
I've seen that. What is that? Like it's literally like a tree.
Yeah,
like a tree trunk. You see rings.
Yeah. It's just where the hoof wall is stretched a little bit because we've had that drop.
Okay.
And once the hoof starts growing out and we can kind of, farrier, snip all that away, I guess.
Yeah.
Take all that away. It does take time.
Mm-hmm.
We can hopefully get the horse into a place where they are a lot more comfortable. But
yeah.
in terms of, can you ever get that pedal bone to kind of move
Come
back
back.
up?
Yeah.
And not necessarily, but you can do things with the hoof
to support and help.
Yeah, exactly.
Okay, so like you said, like the pedal bone will probably never go back where it should be or originally be. Does laminitis then affect the horse's performance? Like when they have laminitis, you won't exercise them because they're obviously in chronic pain and things. But once they've obviously come out the other end, can they? If you ever had a horse that was, I don't know, eventing hundreds or whatever, can it just go back eventing hundreds? Or once they have that, because obviously the changes in the foot and the pedal bone, would that affect performance in the long run?
It can do, yeah. I mean, once you've had Lammy, obviously you're not being exercised anymore, so there are other factors apart from that you have to consider if you want to get to that level of work again. Once you've kind of got rid of laminitis and they're comfortable, there is nothing to say that you can't return to that level of work, but you just have to be careful. Again, we kind of touched upon Lammy can sometimes be caused by trauma as well, so they will have kind of more sensitive feet than a horse who hasn't had laminitis. But I've seen a lot of ponies last year in particular who came down with laminitis who are now kind of back to their sort of full athletic function. But in ponies that are in that sort of intense work, obviously we're speaking about leisure horses usually, but in ponies that are that more intense work, then it is just something you should be aware of if they've had history of it. And as soon as you sort of think that they're not quite right, then just be proactive and get us involved.
When you said like trauma, does that mean like they had a really stressful time, the horse, or trauma in terms of like, I don't know, being overjumped or working on hard ground, that type of trauma?
Yeah, so mechanical trauma. So, really hard ground. I mean, sometimes if you turn a horse out and the ground is really hard and they've gone galloping around like a loon, they can come in and just be a little bit footsy. It's quite rare that we see really significant laminitic cases just because the ground's been a bit hard, but it has
you probably see other injuries
with
exactly working horse on hard ground than actual laminitis. So like that mechanical, obviously hard work and probably stress factor of it can actually create laminitis for a horse. And so it could be obviously not a fat pony or a horse, not obviously gorging on grass, but because of how they're being worked can get laminitis.
But not necessarily the cases where they're leaning back on their heels and they're really, really painful. Usually it's just a little bit of, a little bit of sensitivity there.
Brilliant. I mean, we all know how horrible the winter we've had.
Don't. We all work outside. It's like, oh God, I get an office job.
I know. I mean, today is actually glorious. We haven't. It literally rained every single day in August.
Longest winter ever.
I mean, it started in July.
It did.
Because I have some friends who's got fields, and then I have a friend who been cutting haylage or whatever for over 10 years, and she always cuts in September or August, can't remember, one of them, August, but because it actually literally rained every single day in August, she couldn't, and then it all went to crap because come September when she could actually get the tractor in, it was too late. It all like seeded and stuff, but because you would never say in August you wouldn't have one day of sunshine to cut, but we literally didn't. It literally rained every single day.
I know.
In terms of like, we always say, be careful of, spring. Going into spring is obviously the most. We always hear, it's most kind of high risk time of horses and ponies getting laminitis. Is that because of like what we call like the spring grass, which is just really lush, healthy grass that's come through from the ground from the winter time? Okay, so with the type of weather we've had, which obviously has been horrendous, does it make a difference? So like we've had a really wet winter, does that have any effect on the type of grass that's going to come through this spring? Or would you say actually it's more dangerous if we had a drier winter and then coming into spring the grass is better? I don't know.
I think as we come into spring, whether or not you've had a wet winter or a dry winter, the sun is out more, the grass will, the sun should be out more, in theory. We are in the UK though, so in practice, it's not today though. So I mean, the grass today will be loving this, and the ponies will be loving this. We won't be. No, we don't. So it doesn't really matter. I mean, in my experience, this might be different for other vets, but to me, I don't think it does matter if you've had a wet or a dry winter. It's mainly the spring that is that sort of risky period, to be honest, for the grass to come through.
Yeah.
And I mean, as you say, in summer last year, it was a warm, wet summer. So that is, the two perfect conditions for the grass to grow. And I think that is why we saw so much lambing last year, because the weather conditions were perfect. It matters a little bit less in the winter because, obviously you've got less sunlight. Ponies are usually stabled a little bit more, so they're not out on that grass.
Yeah.
So it really does, the time of year kind of more matters because of the amount of sunlight that we're getting in the spring.
Would you say from a vet perspective, is it a better like management for the horse? My horse hasn't been turned out all winter, but just not just because I'm cruel, just because we did turn him out for like a few hours and he just pulls shoes off. Like,
they do that. Yeah.
I've tried taping the shoes on him. I put overreaches on all four legs. He just pulls it off.
His party trick.
Honest to God, I'm not bothered calling the Varia back out, but I've just seen cases where they don't just pull the shoe off, they rip half the foot off, and I've seen cases where horse have been put down because they've actually pulled too much off, and they were like, that this horse won't be able to wait until it grows back. Like it literally cannot stand on its legs. So that's just why I've not turned them out. So would you say from a man perspective, it's better to, as bad as it is, to turn them out as much as we can in the winter, so they don't have literally no grass for say 2 or 3 months, and then be put out on grass when the ground is drier? Or would that sudden having lots of grass, would that shock the system because they've not had it? Or does it matter? Does it not matter to them?
I mean, it doesn't really matter, to be honest. Everyone's going to have their own different sort of winter management, and that does tend to be they're stabled a lot more.
Yeah.
If you have a pony who is cushingoid, if you have a pony who is EMS, or if you're worried about any of those two conditions, the best thing you can do is get them blood tested before you end up turning them out.
Okay.
Just to be more proactive about things. We can see where those levels, so we look for ACTH in Cushing's, and we look for insulin in EMS. We can see what the levels are resting in those bloods, and then either treat or not treat, depending on what those levels come back as. So I think it's more a sort of case of go about your normal management, but be proactive with these things if you have a horse that you do think is at risk.
So what is the best thing is, if we've got, we don't, but if we did have a massive field, would you say it's better to strip graze them, as such, corner off, so that they only have certain access to a certain amount of grass, or doesn't matter, just chuck them out into a big field and let them eat as much as they want?
So if you've got, again, a horse that is prone to EMS, I love strip grazing. I think if you've got a pony that has to be box rested and they're EMS, management is really tricky with these horses. Really, really tricky. I would rather a horse be turned out, to be honest. But some horses you just can't, which is where sort of alternative turnout methods, I guess, come in. I love strip grazing, and I think it works really, really well. I like bare paddocks. A lot of owners aren't a fan of that, but let me tell you, if there is any forage, if there is any grass, your horse will find it, okay? They will find it. Muzzles as well, which I know aren't owners' kind of favourite things, but I do think that I'd rather a pony be muzzled than come in with sore feet and, have months and months of lambing treatment. So those alternative sort of turnout methods, I think, have to be considered in some cases of turning your pony out for the spring.
I've had experience of a pony having been diagnosed with laminitis, and the vet did say it needs to basically not eat, but then there's the factor of ulcers, because I know what laminitis, especially if they're fat, is to obviously get the weight off, and then the only way of doing it is basically feeding them less or basically soaking their hay. What's the danger of trying to get them to lose weight, but then the problem with ulcers? Because when I actually spoke to that vet, they were saying I prefer him to have ulcers than to have laminitis, and I was like, well, I don't really want him to have either. I don't want to have either. But he was like, I'd rather you not starve, but not give him as much food. But then I'm like thinking, well, is he not going to get ulcery? What's what is worse? Because I've seen horses with ulcers and they're vile to be near. They're vile. Some of them you can't even ride them because obviously the girth and the leg on them, they just buck and rear. Like, what is worse?
So
like veterinary wise, like health wise, what is worse? Like having an ulcer belly or having
So none of them are ideal. But I'm in agreement with that vet. I think if you've got a laminitic pony, treating the laminitis and limiting their access to food is a lot more important than if they're ulcery. That's something that you can tackle once your laminitis is cured. I think not enough emphasis is put on how painful that must be. Horses walk on their third finger. I'm not going to put my middle finger up. But that's where all of that weight is
it the pedal bone then?
Yes, so that's sort of pedal bone dropping through. You can imagine how painful it must be if you're expected to walk on your fingertips and they're not quite working. And even, if you I don't know, doing something and your nail gets pulled back sometimes, that pain, you're like, my goodness me. And that's kind of what they're experiencing, but tenfold and all the time because all their weight is going through. So I would rather treat the laminitis, change the diet, get better, and then go investigating ulcers. And if it's the case that they do have ulcers, I'd rather them be ulcery and free from laminitis than laminitic, but they are on an ulcer diet. And again, laminitis, it will be a temporary treatment. They won't necessarily have to be completely stripped and starved the whole time. There will have to be permanent dietary changes, but I am in agreement with that other vet that you spoke to about treating for lammy first and then think about ulcers later.
And then if they have laminitis, like feed wise, I've always been told, like soak the hay, like, and just soak the hay for 24 hours. Other than obviously soaking hay, what feed wise, from is there anything you would recommend? Say don't feed because this actually makes it worse, or feed this. Especially, let's just say we had I don't know, thoroughbreds are not normally chubby like your ponies.
Yeah.
Well, obviously thoroughbred tends to find it hard to hold weight, and we tend to obviously feed to keep that weight. But does that then contribute to the laminitis?
So I don't have a horse of my own at the minute, and the feed market is just always changing. There's everything, coming on and off the market all the time. The most important thing is a balancer. So if you're soaking hay, which we'll touch on in a minute, because that's always kind of controversial, isn't it? Everyone's got their own ideas. But if you're only feeding soaked hay, okay, you're drawing all the sugars out of that, but then you're drawing all the minerals and all the important things. So just a balancer. Is what I would recommend for the fatties.
I've actually never thought about that.
Yeah,
I get obviously. I know you're taking all the sugar and nutrients out of the hay, but I never actually thought. I always say when you're feeding them soaked hay, it's like literally eating cardboard. Actually thinking now when you say balance, I'm like, so if they're eating cardboard, they're getting getting nothing.
Yeah, none of the stuff that they need.
Yes.
So a sort of low cal balancer. Feed stores are really good actually in tack shops because they will have someone that's qualified in knowing what to give you. If you've got kind of a thoroughbred, as you say, that doesn't hold weight too well, there are loads of sort of anti-lamb, so Top Shop Light I think is really low in sugar that you can feed them. There's loads of sort of alternative chop and things like that
so like a low sugar diet is the way forward. Okay, so like you said with soaked hay, what are your
this is interesting
from a vet perspective, right? So I'll tell you what I know. So I'm not qualified in any shape or form. I just know what I know from my training and qualifications and just being in the industry. I've just basically been told that if you soak it for 24 hours in water, you take literally everything out, so all the minerals, all the sugars and stuff, and then you see all the dark brown color in the water, which is what is being taken out, and then you're just feeding them to basically eat cardboard, so they're filling their belly, but they're not getting anything. They're not getting any value out of eating. But obviously they need to because they're continuous grazers. And then if you soak it for 12 hours, you're taking some out, but you're not taking everything out, so they're still getting something out of it. So I don't know, from a vet perspective,
this is really interesting. We were literally having this discussion on Tuesday, so a couple of days ago. So I've always said at least 6 hours. We actually had Top Spec come in and give us some CPD to give us a talk. And it's been found now that it doesn't really matter. The time doesn't really matter. It's the amount of water.
Oh,
so
okay. I've never heard of that.
And it does make a lot more sense because, I mean, once you put the hay in, you've then got, I'm going to go back to like year 9 physics. So
I'm rubbish at physics.
I know, I'm like really check when you see the cogs whirling. So once you put that hay into a new bucket of water, that osmosis curve is basically working straight away at drawing all the stuff out of the hay and into the water. So I've always said 6 hours, but it was found that if you are soaking a 2 kilogram net in, I think it was 25 to 30 litres of water, which
so
will be...
do my maths stuff, I'm just thinking, so 10
you could do
10
the
times.
numbers.
so 10 times in litres to what you've got in kilos. You've got 20, you said 2 kilos, you've got 25, so just over 10 times.
10 times.
Okay.
Then you can leave it for an hour.
Really?
Yeah, so...
But then, like, you would think, logically, but obviously my logic's rubbish, logically you would say, oh, the longer you soak it, the better.
Once that curve reaches that sort of, I don't know, maximum gradient or equilibrium is the word.
Oh God.
once that curve reaches that equilibrium, it doesn't matter if you soak it for 12 hours or 24 hours, no more is going to be sucked out. So it has been found that an hour, as long as you have enough water, is more than sufficient.
Yeah. Oh, I didn't even know that. I was again, I don't deal with a lot of lammy ponies or anything, but I was always told soak it for 24 hours. So I'm literally like filling this bucket every single day and making sure that I've got buckets soaked for 24 hours. That's what I was always told.
Oh, you learned something.
Yeah. Oh, definitely. So it's definitely learning day.
EMS and Cushing's, I don't think I've sort of explain the difference between the two.
Yeah, we can do. Yeah,
because they are the kind of the main culprits. When
I didn't even know. I just thought laminitis. I just thought laminitis was just laminitis.
Surprise!
Yeah, I didn't even think it was linked. I was just so your pony's fat is going to be prone to laminitis. I'm just like, okay.
Yeah, no. So 90% of lammy cases are caused by those endocrine conditions. So the first one that we'll talk about is PPID, which is the fancy name for Cushing's. So it usually happens in those older ponies, so sort of 12 plus onwards. The main signs that you'll see is that long coat, the curly coat, loss of top line, which can be difficult to kind of recognise in an older retired horse.
Yeah, and especially if during winter time, this winter no one did anything.
Yeah.
You're not schooling twice a week or 3 times a week. You're not doing anything.
So you're going to lose your abs.
Yeah, exactly.
So that sign can be kind of difficult to establish. Is it?
Unless you've got Filegro.
Yeah.
And Filegro doesn't have a top line, then you're like, okay, yeah. Then you're like, oh, then you'd say something. But on a daily horses,
it can be a lot more tricky.
It's going to be difficult to see.
Yeah, to notice. That's just one of the signs again. PUPD, which basically means you're drinking more and you're peeing a lot more. Owners will notice. You're the ones mucking them out, and you're picking up the shavings, and it's like, why is it so
more money? All I think about when I'm picking that up is money's going in the bin.
How much does a bag of shavings go for nowadays?
Oh, I think it's £9.
My soul just left my body.
Yeah, 9 for bail. I'm pretty sure. Don't quote me on it.
Wow,
but I'm pretty sure. If you get the good ones, the good ones. Yeah.
Oh.
So that's what I'm saying.
To poo and pee on.
That's what I'm saying. Every time I'm picking up a fork, I'm like, money.
Okay, that's fine.
That's another 50p. That's another 50p.
Oh my gosh, I'm out the loop. I've not had horses for quite a few years now, so I don't think I'll be getting one. So that the kind of more wet bed, the increased thirst and increased urination, they can get kind of more sort of, I guess, weirder signs. I've seen a lot of skin conditions in older horses, so patches of alopecia, flakiness, itchiness.
I've seen that.
Yeah, and we've tested them for Cushing's. The ACTH, which is the hormone that we go looking for, was through the roof.
Yeah.
We started treatment and the skin condition went away. So I think that's an increasingly more common sign as well.
Like, how is Cushing just something they get when they're older, or is it, I don't know, is it inherited? If their grandmother or the mother had Cushing, does that mean they're more prone to it, or is it just something that ponies and horses just get?
So I'm not hugely sure about if there is a genetic component, but Cushing's is an age-related disease, so it happens to the pituitary gland, which sits in the bottom of a horse's brain, and that undergoes sort of age-related degeneration. and then essentially can't respond to the hormones that are telling it to stop doing its thing. So it doesn't respond to dopamine, and then increases secretion of ACTH, which
that's where you see when you test them.
Yeah, which is the hormone that we go looking for.
I hear people saying that, if you've got a curly coat, it's obviously a danger of that they've got cushion stuff, and their coat gets quite thick and stuff.
Yeah.
Would you say, from a veterinary perspective, because obviously when you're walking in the winter and they've got this thick curly coat, they get sweaty, like, would you recommend to clip them, or would you say don't, because it causes the body to react more, going, there's no coat, create more coat?
Big advocate for a haircut.
Give a haircut.
Yeah,
okay.
Yeah, a big advocate.
Does that make any difference to the, I don't know, the hormones of the brain to go, oh my god, you've got no hair?
No, it doesn't really make a difference, sort of, I guess, in a clinical sense, but I just think it keeps them a lot more comfortable and a lot happier. You can imagine, I mean, what it must feel like walking around in this huge fur coat. Yeah, exactly. I'd rather clip them out and rug them than, I mean, don't get me wrong, I mean, some horses do quite well with this thick coat, especially through winter. But if an owner asks me, I'm sort of and ahhing now, I'll be like, give them a haircut.
Okay, so haircut is good.
Yeah.
Okay, no, fab. What about, you were saying EMS, what's the difference from EMS to Cushing's?
So EMS is more to do with insulin dysregulation, so it has nothing to do with
a diabetes, you were saying?
Yeah, it's quite similar to diabetes. Has kind of nothing to do with the pituitary gland in the brain, just has more to do with the insulin state of the horse. Again, it happens in younger horses compared to Cushing's. But
so it's like the opposite then?
Yeah, essentially. So horses kind of 5 years old plus, don't get me wrong, you can have a Cushionoid and an EMS horse at the same time.
Oh, okay.
Which is really fun to deal with.
Oh,
which is great when you're looking at the blood test and you're just like, which one is it? Just do those. But yeah, it tends to happen in the sort of younger population of horses. And there are at-risk breeds, so native horses, cobs. I think we found that quarter horses, which aren't as common, I guess, in the UK.
Because we don't really have much.
Yeah, we don't really have many. I know that I don't think I've seen one since I've been working here, but maybe in the US, they've got a lot more quarter horses. Yeah, they've seen a lot of EMS there. And again, it is more kind of less to do with that little gland in the brain, more to do with the actual state of and the levels of insulin running around the horse. And
if they say from a young age, say 5-year-olds get EMS, do they, I don't know, and with humans, if they're diagnosed diabetes, like you've got for the rest of your life, is that the same with a horse then?
Yeah.
They've got it forever.
Yeah.
How would you manage? Is it just medication? Is that how we would manage that?
So once we diagnose your pony with EMS, we know that they are an EMS positive pony. They're always going to have it. They're always going to be at risk of laminitis flare if that insulin goes through the roof. So in those initial stages, if they presented as, super sore on their feet and really, really fat, we start with medication. So we used to use metformin. I don't know if you're kind of familiar with that.
No.
So it used to be ridiculous, about, I don't know, I'm probably exaggerating here, but about 50 tablets a day, and it used to be a huge dose. And in some ponies, they really did benefit from it, but in other cases, it was a sort of bit hit or miss as to whether or not they worked. Now, and in recent years, we've got 2 other medications that have come onto the market. So we've got Steglatro and Invokana, which I love. I think they are really, really effective. Invokana in particular, because it can actually help your horse lose weight whilst they're stood in a stable doing nothing.
Oh wow!
Their feet
okay,
hurt.
I need that.
It's like, what is that one that's going on America? Like Ozempic or whatever. That's a huge one right now. I don't know. All the Kardashians are taking it, which is why they've got all these like
curvy
bodies.
Yeah,
exactly. So yeah, I guess it's just like a BBL for horses.
Yeah.
But yeah, Invokana and Steglatro, which I think are so much better in kind of making those cells more sensitive to insulin, so to like suck it all up and get it out of the bloodstream and prevent laminitis, or at least treat it.
So they're basically holding their body's not knowing or telling the body to like secrete the insulin, it's just holding all the insulin in.
Yeah. And as I said before, I mean, they eat those high carbohydrate meals or the grass or whatever, and their insulin spikes, tenfold what a normal horse's insulin should spike if they're an EMS pony. So they're always in that hyperinsulin state. and it can just take one sunny day for you to turn them out and send them into a bit of a lammy flare up.
Okay, so if they have EMS, they go to a flare up. Do they just kind of like have like a lammy episode, like a short episode, and then when the insulin kind of drops a little bit, that disappears?
They can do. I mean, getting the insulin down is kind of the first line treatment, and something that we do recommend that owners do start on the medication. It's medication that, I mean, compared to Cushing's, we'll touch on this in a bit, but the medication isn't lifelong. It's usually kind of between a 6 and an 8 week course.
Oh, that's not too bad then.
Yeah, exactly.
Oh, so I was about to ask, it's like, is this horse going to be on like 50 tablets a day, like for the rest of its life?
No, it's really nice because the Invocana and the Seglatro, you're looking at like 1 tablet, 1.5, half a tablet, nothing like the amount of metformin we were giving.
Okay.
Which is, I always really appreciate that, especially if the pony's previously been on metformin. And we're like, oh, we've got new tablets, just one a day. They're like, yes, oh gosh, I know, thank God. So yeah, I found that they're really, really effective. In terms of sort of managing and making sure that this doesn't happen again, your management changes are key. So we kind of touched upon, alternative sort of turnout methods. So strip grazing, putting the muzzle on, turn them out onto bare pasture, just not letting them have free range access to. I know it's cruel to be kind, isn't it? But not letting them have that sort of free range access to a huge field. Soaking the hay still, being really sensible with what sort of concentrates and hard feed that they are fed. Sometimes I do have to
low sugar again.
Yeah, I do kind of avert my eyes sometimes when owner brings their feed. Like, oh, is this okay? And it's like this huge bucket. I'm like, it's okay for now.
It's okay for a week if you're going to use this for a whole week.
So that sort of thing. And exercise is really, really important. So exercise has actually been found to decrease the insulin in the.
It's almost that's for like humans as well. If humans are like, depending obviously your health, but if obviously you've got like your diabetes or like have more low level health issues, your doctor would say go for a walk. Keep active. Don't just sit on the couch.
Yeah.
So will that be the same with the horses? Obviously not competing them like high level, but like regular schooling, hacking, lunging,
definitely
keep them moving.
And obviously it's tricky in that initial sense because the laminitic, they can't move. We've been told to keep them on box rest.
It's so hard to watch when they're like you can see they're uncomfortable where you're like, it's better if you just walk for 10 minutes.
Yeah, I mean, I like to strict box rest them for at least 6 weeks. I just think it's just not worth the state of pain that they're in. I'd rather than be fat and sat in a stable. And kind of getting better in that sense.
Like from a vet perspective, when you going out to see, seeing your clients, seeing the ponies, and you normally obviously see them at the yard, and you can have a feel of what the yard is when you get there.
Yeah.
Is it difficult as a vet? Like, you'll tell them like this is like moving forward, this should be the plan on how to deal with the pony with the laminitis, EMS, or Cushing's. What percentage would you say that they actually listen to everything you say rather than do? Because none of us wants to do wrong. We all want to do the best for our horse and pony, but sometimes we do. I mean, I do it. I mean, I put my hand up like, we think we know better, even though we've got the vet out, we've got the X, Y, and Z out. We always say, oh, well, I know better because it's my pony. What percentage would you say like that people actually listen to? Okay, I need to strip graze it, I need to soak on my hay, I need to do all this.
I would say the majority of owners are pretty good, especially if we've got that and the horse is already laminitic, which goes against, I said before, laminitis is better to be prevented than treated, but if they've seen the fact that their pony's in pain, they usually are pretty good at making those changes. It can be tricky in a livery yard. Obviously, you're kind of bound to what the yard owner wants to do and your sort of facilities and things there, so it can be a little bit tricky. Majority of them are pretty good, and at the end of the day, we can be called out, we can give our advice, we can give our treatment, and if they want to kind of poo-poo all that and not listen, then there's only so much we can do. But
it's just so difficult as a vet though, that you're like, I am the qualified person
big girl pants on and be like, actually I have a degree.
This is what you're trained and qualified to do, and there's a reason why you called me and you didn't just deal with it yourself.
Exactly. And I mean, as long as you attend a visit, I mean, the first thing in veterinary medicine that you're told when you start your job or you start uni is do no harm. As long as you attend a visit and you at least give that animal pain relief and a thorough clinical exam and have a discussion about Lammy and about management changes and testing and things, then if they don't want to follow any of that advice, that is out of your hands, really. You've attended and you've done your best.
Yeah, no, definitely. So for care-wise, I would say with laminitis, it sounds difficult, but it's doable. It's a lot just about being disciplined, management of their care. So like you said, your strip grazing, muzzles, bare paddocks, and reducing those sugary feeds. So that obviously seems quite doable for a lot of people. And then the EMS you said about treatment, cost-wise. How costly is it to manage a whole pony with laminitis to EMS to Cushing? Is it expensive? Is it relatively affordable for everyone?
Yeah, so it can be expensive, and that is something that we do recognise. So EMS, if you go on the medication, if you get the radiographs done, if you go down the remedial farrier route, it does add up. It really can sort of ballpark figure if we come into the sort of end of treatment, and it's a long course of treatment. It's not something that
how long is it, like two months you say?
So I like to put them on the tablets for 6 weeks initially, re-blood test them, and if we're still not happy we can go for 8 weeks, start weaning them off. If they're not kind of responding, you've also got your pain relief as well, so your box of bute and things like that. It can add up, and
roughly how much
so
at the end let's say 8 weeks we've got. Done 8 weeks and it's good, it's all looking hunky-dory. What's the bill at the end of the year?
I would say sort of ballpark between about 700 to 1500.
That's not actually that bad. That's actually not that bad. I know that is a lot of money. But I in my head I was expecting you to say like 3,000. That's literally I was expecting to hear like 3.5. I was like, that is really. But that's not that bad for it. I mean, 8 weeks, like 8 weeks of treatment, and then so after that, you don't need. Did you say you do need tablets after that? Or you don't. After
no. So for EMS, we don't use them long term.
Okay.
In the majority of cases, if we start them on a 6 to 8 week not trial,
like program.
Program. That is usually enough to bring that insulin down.
And then you don't need to, unless obviously it flares up.
Yeah.
Then would you need to go back to the 8 weeks again when it flares up, or is it something that you just do for, I don't know, like a short period of time just to control it again?
Yeah, it depends what kind of works best for that pony in particular. If it's a flare up and you catch it, you can start them on the tablets. And this is where communication is really, really important. So keeping checks, making those phone calls, just checking in and seeing how things are going and whether or not you can sort of taper those medications down.
Okay, so that's EMS. What about Cushing? Is there any treatment for?
So there's one treatment. So it's called Presend, and they come in little tablets, and it is lifelong. But that is usually because the horses are a lot older. It's kind of the only thing really that controls that ACTH and
so it's like every day they have to take it until the day they pass away. Okay, is that an expensive tablet?
It can be. So I think
it's about how big your horse is.
Exactly.
So you're saying like an average 16-hand horse who's about 600 kilos.
So if you are wanting a box of, we sell them in 30, 60, 120, and I think most practices will do the same. I think a 120 box is probably about between 90 and 150 quid at the minute.
So you said so that means there's 120 tablets.
And if your pony's on one a day, then quick maths.
3, 12, 4. So that's like 4 months. So they get so 30 days. That's not that bad. So 4 months. Let's just say it's 100 quid. So it's 20 something quid a month. So that's not that expensive. I mean, that's not that expensive for a horse medication. For a month, I mean, I know it's still 20, 30 quid a month that you've got to pay until that. Obviously, that horse passes. I mean, what happens if you're like, I can't afford it anymore, and you don't give it his tablet? Does it?
I mean, if they're not on treatment, then there's nothing to then control that ACTH. That's a conversation that you have to have, with that client and say, if we stop treatment, These are
what
the
will
risks.
happen?
Yeah,
What will
XYZ.
happen if you...
Most likely a return of clinical signs. I mean, Cushing's is so variable. I've seen it present in so many different ways. If the only thing that happens is they get that really hairy coat and they wee a lot more and they want to go untreated, okay, fine. As long as we're keeping checks and communicating with each other, making sure things aren't getting worse, then you've got the kind of whole end of the spectrum, which those signs are a lot rarer. But I've seen, sort of chronic laminitis and really long episodes there. Neurological signs as well. I guess the pituitary gland does sit in the base of the brain, and if you have damage there, it can lead to neurological problems. In which case, we have to have a more sort of difficult conversation with the owner.
Obviously, with us coming spring and summer, what would you say from a obviously veterinary perspective, like, because you kept saying obviously prevention is better than like curing. Well, you can't really cure, but like caring for them. So what would people who doesn't have a horse who is lammy, let's use that example for a second. People who doesn't have a horse that has laminitis, what would you say would be the best kind of care and prevention now we're coming to spring and summer?
So, I mean, I was very guilty of this when I had my pony, and he was a Clydesdale cross-section day, so he was a big boy. But as soon as summer turnout started, I was very guilty of just rocking it around the field and being like, fun. See ya, see you in a couple of weeks, bye. Don't do that. please do as I say, not as I do. So making that sort of gradual, especially if they're going to a new field, making that gradual change. So maybe turning them out for an hour or two at first, and then building it up quite slowly.
Okay.
Would be my advice. Getting them into a good kind of exercise regime. So at least if they're out, they're kind of working it off as well. And if they are a bit cresty, if they do look a bit chunky, if their coat is long or curly, if they've been drinking weeing a lot more, if you're worried in any way, then just contact your vet, even if it is just for some advice over the phone. They can kind of guide you in that way. If
we do have a pony, for example, that is a little bit chubby, it's not laminitic, I mean, what advice would you give? What can we do at home to kind of start turning? Would you say like just turn them up a little muzzle, or?
Again, I'm a big advocate for a muzzle. Yes, it's cruel to be kind, unfortunately. And just booking the blood test, a vet to come out, assess them, blood test it for insulin, just to make sure that there's nothing kind of hidden underneath it.
If the insulin level comes out fine, obviously you will probably just say mindful of how long you turn them out for and stuff. But if the insulin is a little bit high but not massively high, would you not turn out, or
so would you some owners like to trial management changes before we start the medication, and I have seen a few instances where that has worked.
Okay.
So if the insulin comes back, I think it needs, the lab that we use, I think it needs to be below 6 to be considered negative for EMS or safe, I guess. If it comes back and their insulin is 10 or 12, and clinically there's nothing wrong with them, it's they're not laminitic, they look pretty healthy in themselves, they are carrying that excess weight, then I would say, okay, we need to think about the fact that we're okay now, but your bloods are slightly raised, and if it's a native breed, you're slightly at risk. So what can we do to prevent that? Spanking. Exactly. So again, muzzling, dietary changes, exercise, those are the three sort of key things I'd be
just keep it down.
Yeah.
Blood test, how much is a blood test?
So this is also interesting. So the insulin one for EMS, I think that's about 60 quid, between 60 and 80. The test for Cushing's, if you're just looking at resting ACTH, and if it's the first one that they've ever had, or the first one this year, we can actually generate a code, and most practices will be able to do this. We can generate a code, and then the lab fees are completely knocked off.
Oh wow, that's really good.
Yeah, apart from the sort of obviously the visit and the blood sample collection fee, if the practice does use that, then it's completely free.
Oh, that's really good. No, that's super. So if you have a horse that is already had laminitis previously, what would be kind of your advice? Turn them out now, spring, summertime. Is it the same? Just
Yeah, I would say please let me blood test it before we
Okay.
before we go out onto the paddock. Again, I am very, very proactive and kind of anal sometimes
Yeah.
about this. But
what difference does it make? Like, what difference does it make? Like, if you do like a blood test, like it's laminitic, you've done a blood test. What was a different advice you would give the blood test come a bit higher or it's a bit lower? Is a different advice you would give?
Not necessarily, no. It's just nice to have that initial baseline before they go out. And if that baseline is raised and really high, then we can treat them. And
like
then
before they go out?
Yeah, before they go out. And then hopefully they can at least spend summer, even if they are muzzled or on a robust pasture or strip graze, they can hopefully have a summer free from laminitis, especially if they have previous history of the condition.
Yeah. Well, there's the question I was going to ask you about laminitis. What was it? Now come on my head. Now it's gone on my...
We're gonna have a sip of water whilst you think.
Now it's gone on my head. When they get laminitis, does it just like happen overnight, or does it take like a couple of weeks, a couple of months for that to build up and then lammy shows, or is or is it?
Yeah. So usually it
like
is...
abscesses, like just like you just get it, like you could ride it in the daytime and in the afternoon they're like dog leg.
My leg.
And you're like, what? Did you just break your leg? Like, what's wrong? So like, what laminitis is it like? Is it a build up, or is it just if you just suddenly throw them out on fresh grass and they just gorge for a few hours, it just skyrockets?
Yeah. So the most common sort of cases that we end up going out to are they've been fine when they're brought in from the field, and then in the morning they're stood like this. So it can be pretty rapid onset. To be honest with you, I think last year, because we did see so much of it, there must have been so many ponies that were kind of teetering on the edge. So their ACTH hadn't been tested or their insulin was raised, and because we had that lovely warm wet summer, they did end up gorging, and that was just enough to just send them over the edge and into a bit of a lambing flare up. But it usually is quite sort of rapidly the onset of signs within a day or two.
Okay, so yes, so I suppose that's, even we try and prevent it, it's hard to manage and really prevent it, because there isn't like, oh, here's a little sign that I'm getting lammy. It's like, I'm not lammy, and it's, oh, I'm lammy now.
Yeah.
Yes, because I'm not lammy, so then lammy within a few hours.
Yeah, I mean, some owners are really good. Like I actually saw one yesterday who had escaped from the field and got onto this lovely lush part of this woman's garden. And she said within, we knew that we'd bring her in and she'd be stood on her heels, and that exactly happened. So owners can be really sort of in tune with what the sort of triggers are and control it that way. But if your pony's a bit of a Houdini, then it can be pretty difficult. But yeah, it usually is quite a rapid onset of signs.
Yeah, quite quick.
Yeah,
that's probably why. Yeah, that's why people find it hard to manage then, because it just comes and then, oh, what do you do now?
Yeah, and owners, I mean, I've had some owners kind of ring up and ask about cryotherapy. So essentially just putting the hooves into a bucket of ice. And unless you're doing that within the first, hour or two of laminitis happening, it doesn't do them any harm, but it probably doesn't benefit them.
That's another question. I've seen it before. Going on lammy horses going on water treadmill.
I would say no.
What do you think? So they were saying, like, from what I know, I don't know a lot about treadmills or water treadmill and things like that.
Yeah.
I've seen it, but I've not done a lot of research or experience in it. This, like, what I was told is that being on a water treadmill, there isn't that impact because you're in water. And they were saying, like, obviously being on a water treadmill for like 15 minutes, equivalent to like an hour schooling session or something, because of how intense stuff it is. So they say it's good for weight loss and stuff. So if a horse is lammy, and like we said, we need to get that weight off, is water treadmill actually good? Because then you're taking obviously the rider weight off, so that's obviously less weight on the hooves and stuff. Like, is water treadmill a good idea? I don't know.
I would say no. Especially if they are in the midst of that really sort of painful period. I think box resting and medication and dietary changes, especially in that sort of acute period, is key. And once they get to a place where they are sound. If they are still a bit porky, which the majority of them will be, then a
Mhm.
water treadmill can be a really, really good way of shifting that weight.
So like after they've after when it comes sound, water treadmill will be a good way, obviously, for build like getting them to weight loss and build that up.
Yeah, definitely.
Brilliant. Yeah, I was just thinking. I saw someone put a post up of the horse going on like a water treadmill. And I was like, oh, never even like thought it was then going on for 15 minutes.
One near here, isn't there? But I don't really have much sort of experience.
That's what I'm saying. I don't.
Them.
They were like, oh, going on for 15 minutes equivalent to an hour of schooling.
Yeah,
so
I guess the resistance is there, isn't it? But
yeah.
For lammy horses that are painful, I would say hold off on that until
hold off on all exercise,
all movements,
movement. Just sit in the stable and be fat.
Basically.
Thank you so much, Meg, for obviously joining us today.
Thank you.
Thank you so much to Wright Morten for obviously having me over for this afternoon. I had so much fun. I've actually learned a lot about laminitis, EMS, and Cushing's. I knew like the basics and like the definition and like sort of clinical signs, but I think it's so good to hear from a vet because like I said, you guys are trained and qualified, you guys know more, and there is so much more scientific behind it than that, because I actually never knew that Cushing's and EMS was linked to laminitis. I thought like laminitis was just on its own, like laminitis, but I didn't know that it was. I actually never knew that it was actually hormonal. It was always like high sugar level. So I always just put it to high sugar level, like high sugar like grass and stuff, the lush grass with high sugar would just trigger laminitis. Like I never actually knew it was all linked. So no,
every day's a school day.
Every day's a school day. Well, thank you all so much for listening, and hope to see you all soon.
Thank you.
Thank you.